The first case of Ebola has been diagnosed in the United States. Confirmation of the individual's illness was made by the U.S. Centers for Disease Control and Prevention and the Texas Department of State Health Services on Tuesday. The patient arrived in Dallas, Texas from Liberia on September 20th, and he developed symptoms of the disease on September 24th. 2 days later, he visited the emergency department at Texas Health Presbyterian Hospital. Health officials did not immediately suspect Ebola. 2 days later, he returned by ambulance and was admitted into an isolation unit. Officials said the hospital is reviewing its procedures to determine why staff didn't suspect Ebola the first time. The patient isn't the first to be treated for Ebola in the U.S., but he is the first to have become ill stateside, raising concerns that others may get sick as well and spark an outbreak. Ebola is a viral disease that is spread through contact with bodily fluids. Officials have launched an intensive medical and public health effort to treat the patient and to identify and monitor those whom he may have exposed to the disease.
The bottom line here is that I have no doubt that we will control this importation or this case of Ebola so that it does not spread widely in this country. It is certainly possible that someone who had contact with this individual, a family member or other individual, could develop Ebola in the coming weeks. But there is no doubt in my mind that we will stop it here.
Dr. Frieden has also briefed President Obama on the case. The Ebola outbreak in West Africa has killed more than 3,000 people this year.